Well, hello everyone. This is Dr. Ellithorpe at Tustin Longevity Center here in Tustin, California, Southern California. We meet once a week at 6 o'clock to 7 p.m. We're a group of preventative, functional, alternative, complementary, however you want to describe us, integrative physicians with various backgrounds: internal medicine, general medicine, family medicine, and GYN medicine. And we're all here trying to help our patient base to support them in restoring their health or returning or preventing their health from deteriorating, because we're in a population system of food and pollutants and stresses, electromagnetic waves, and uh, issues that are challenging to our cell membrane health, our total health. And every time I hear from patients, I just get a feel that they're not being heard. No one's listening to them. We're trying to do our best as physicians to represent the old time medicine, hearing them, trying to give them enough time, and trying to work with them to help them fight through this uh, artificial electronic type of mass medicine run by a top down system instead of good old fashioned bottom up health and prevention. So we meet here weekly, and you can get our newsletter by going to our website, tlcdoctors.com, tlcdoctors.com. And if you get on our website, you can join us by going to that website, and on the link there, you'll get notification. And the notification of these meetings does have a little link where you can type in questions. We get our questions every month, every week. And I try to do my best to answer them off the cuff. This is at the end of a workday for me, and so it's challenging to do this and to try and respond and be up on this. And then, of course, I'm now always in my workout clothes because I go right over to do my weight training with my husband afterwards. And so that's why I'm not in a dress at this time. We have the YouTube. If you're on YouTube, you can type into the live chat, and we will try and go to the live questions first, and then we'll go to our email questions. And if we have any time, I have an article I might be able to go over that with you. So today is May 14th, 2024, and we'll begin with the live chat here. Barbara says, lifestyle aside, because I do all the things that you recommend, but can't get this weight off from menopause, and my C reactive protein is high, so I am desperate. Would you ever recommend a GLP-1? These are the types of medicine that are out there, like Ozempic. These are the injectables that block the GLP-1 receptors in the intestine, and they act as a, you might say, a inhibitor to gut peristalsis, moving and churning, and that gives you a sense of fullness. And some people have terrible reactions to this. There are some thyroid concern, lung issues. I would have to say, Barb, I would not try a new medicine like this. One of the jobs I have as a doctor is to try and do no harm. And I have to balance between what is out there in research and that is new versus uh, trying to look ahead like a parent over a child. You know how you're always trying to let your child have the best life, and you're trying to advise them that something that looks like a quick solution to something they want. Um, and I have reservations about the uh, Ozempic injections that are GLP-1 inhibitors. Therefore, I would have to say no, Barbara. I would not go to the GLP-1. These shiny, silvery, tinkling looking items um, do not appear at this time to be safe enough, in my opinion, to recommend to my patients. I would wait a couple of years. I don't know how old you are. I don't know what other comorbidities or concerns you have, um, what other medications you might have. You go on to say, what about microdosing peptides using a compounding pharmacy? I have almost zero food noise. I'm not quite sure I know what you mean by saying zero food noise. Maybe you're meaning you don't have food allergies? You're low carb for years, but can't lose any weight. You gained 35 pounds in menopause, and my body won't switch to fat burning. I have to say, I'm almost in the same boat. And I certainly, if anybody, know all the gimmicks and stuff. And I have resolved now that I'm 70 to just enjoy the fact that I am healthy and I can work out and do things. I have not really gotten down to the weight that I wanted to. Um, and um, and I don't want to use risky new, inhibitors of receptors in my body. I don't want to use stimulants like phentermine. I don't want to use high doses of thyroid as a um, metabolic stimulant. Some people do that, and uh, I would rather just be honest with you, Barb. I don't have the answer. But I do know that there's research. If you look in the research regarding the mesomorphic person, and these are people who actually may have a, BMI above 30, but really still under 34, that these people have about an extra 30, 40 pounds on their body. And long term, research is appearing to show that mesomorphs have the longest life expectancy. And they don't understand why. What is the metabolic understanding, the lab identification, if it's possible? Certainly, we don't have a gene identification code to find out why some people who live right, eat right, exercise, go to bed, drink enough water, uh, avoid food allergies, try to eliminate, food allergies, why some of these people are mesomorphs and they always carry about an extra 30 or 40 pounds, and yet they are the longest lived group. So I don't have the answer, Barbara, except I rejoice in health. One of the things, if you have a high C reactive protein, you might have root canals or you might have a crown. Dental health is another whole field of looking at chronic low grade infections, and you wouldn't necessarily have any pain, especially in a root canal. The nerve is killed, but it could be a site of infection, very low grade, and that could be creating the elevated C reactive protein. So, going to see a biological dentist. Here in the Newport Beach area, there is a Dr. Sun, Son, right by John Wayne Airport. I know about him. I'm sure there's others that are good. But when I did my second doctorate in integrative medicine, this was an area that was certainly a concern for C reactive protein elevation. So that would be another area I would look into. And indeed, I'm looking into that myself. So hopefully that gives you some background in it and some encouragement and some direction. Let's see, in the live chat, we're starting to get in some new items. One is from Christina. Hi, Dr. Rita. What can help with a cough from a virus? Virus is gone, but cough is lingering. The doctor said the lungs are clear, but I do have mucus on and off. Well, damage to the uh, cilia. These are the little wavy fronds on the top of the respiratory epithelium that are waving and trying to move up and bring up the phlegm. Can be damaged, and that can be inefficient in trying to expectorate, bring up this damaged fluid until a new cell grows in its place. That's one cause. Also, this is the time of the year with pollens, and we've had a lot of water, and we are having an increased allergen phenomena. So that could add to a cough that would be a non, like infectious cough from viruses. Um, we're having some concern about the vaccinations that were administered, the mRNA vaccines that may have had some long-term impact to the microvasculature in the lungs. We are also concerned about, of course, hopefully you're in a healthy air environment, and not, breathing in toxins from cleaning agents in your house and dry cleaner material, things like this. We usually encourage people to do a high dose vitamin C drip. We often will use EDTA chelation to improve the capillaries that are right at the cell membrane surface to help bring repair material and remove waste material. We also use the high enzymes to facilitate the disinflammation from that. Sometimes, with the new studies and concerns about long-term COVID, long-haul COVID, we'll use a trial of ivermectin, and we'll run that for maybe 3 months, uh, putting them on ivermectin for 10 days and then twice a week thereafter for another maybe 10 weeks, and see if that will improve it. We often give N-acetylcysteine. N-acetylcysteine, NAC, is a micronutrient that is very much involved in glutathione production, which is very important in cell energy and respiration, and in the lungs, glutathione production to help restore, repair, and return the mitochondrial function into producing very good energy. Acting also as a mucolytic agent, Mucomist is a medicine that has been used to help with this. Tylenol overdoses have hurt the cells in the liver. Using N-acetylcysteine is helpful for that and other cell damage, including the lungs. So there's many things that we can do to work with that, using Argentine silver and squirting the nose, squirting it up your nose morning and evening or multiple times a day for any lingering viral or secondary viral low-grade infections that may follow the initial insult. We try not to use antibiotics, so we preserve your good probiotics in your gut, which helps your immune system. Drinking plenty of water to help facilitate the entire environment of healing. That's some of the areas that I would start to look into. Hopefully that's helpful to you, Christina. Barb has a comment. I think she's the same Barb that was talking about the difficulty with the elevated C-reactive protein and weight postmenopausally gained. So Barb says, I am 53 and on no medications. No food noise means I don't crave foods. Okay, there you go. She went on to say, but I do have lipedema. Um, and she's on no medications. Barb, you might just be one of us who has the mesomorphic genome and presentation, and that is just your body's mechanism of health and maintenance in your body. The fat in our body is a toxic dump site. We do know that toxins will go into the fat to try and be an inert depot to put these toxins. And so some of this fat gain, we are realizing in research, is indeed a safety mechanism. But I still would go look at your teeth. I don't know if you've had a hip replacement or a knee replacement or other implants, breast implants. These implants are also another source of chronic, quasi-toxic stressors to our body that would raise our C-reactive protein and present challenges to our metabolic well-being. I hope you have a good functional doctor that will work with you on this. I don't know if you're on natural hormones. I don't know if you have systemic enzymes, if you're using that to help disinflame your body. I certainly would do a trial of EDTA chelation therapy with vitamin C to kind of promote detoxification, microcirculation enhancement. All these things tend to improve the metabolism and some of the detoxing pathways. Um, I would want to look at a antioxidant assay. I would like to look at a complete digestive stool analysis, and maybe a food sensitivity. You could be innocently eating a healthy food that you have developed a immunoglobulin G slow reaction to, and this low-grade inflammation may be sensing irritation, and it holds on to the weight as a mechanism of self-protection, you might say. Christina says, how do you know if you have ovarian cysts? Well, you wouldn't necessarily know. You would have to have an ultrasound for that, Christina. She goes on to say, I suspect I have them sometimes. Yes, because they can come and go. Simple cysts are, when a egg ovulates and a cyst or it is trying to be developed, other oocytes don't actually rupture out, and these become cysts on the ovary. So she said, I suspect I have them sometimes. I have a lot of symptoms. Is it normal to get them? Should I get a pap smear? Well, Christina, nuns who are sexually inactive don't need pap smears. But if you're sexually active, you should. And I would get a transvaginal pelvic ultrasound to look at the sound wave imaging of your uterus and the two fallopian tubes on the ovaries and see if they have cysts on them. I would explain to you that stress, and we are in a world of stress today, stress and the cortisol reaction, cortisol or stress hormone, is a prevention of the follicle stimulating luteinizing hormone to our gonadal axis, so the ovary and does not get its proper hormonal stimulation cyclically every month for ovulation. Therefore, progesterone is usually very, very valuable and very benign, very safe, very natural to take day 15 through 25 of your menstrual cycle, 100, maybe 200. I have some women that I've used up to 800 milligrams day 15 through 25. There's many ways to do it, creams or orally. And that is very helpful, plus systemic enzymes. Now, if you're eating a high carb diet, a lot of bread, starch, sugar, cereal, buns, crackers, tortilla chips, corn, rice, beans, nuts, seeds, fruits, gummies, sweetened drinks, soda pops. That uh, sugar component, fructose component, will stimulate in your pancreas insulin. Insulin is a growth promoting factor. And the ovaries are associated uh, with sensitivity to the insulin, and so they will develop these cysts and ineffectual ovulation, leading to infertility. So, a low carb diet and exercise are a very important part of eating and a healthy diet to prevent these cysts. So, systemic enzymes are anti inflammatory, chew up the debris from the old corpus luteal sac and the inflammation, which is ovulation, rupture mid-cycle, and the progesterone helps to, talk to the feedback of the gonadal axis that all is normal. Because if you didn't ovulate, at least you will have had the progesterone to balance the estrogen stimulatory effect of the menstrual cycle. Estrogen is also um, somewhat of a growth promoting hormone as well. Those are the things that I would do and look at, Christina, and we'll go from there. Barb says, thank you. Yeah. Well, Barb, we have to hopefully find a good functional doctor, and maybe that'll help you along. Uh, Barb at Garden Fairy 351, I didn't say, but yes, I am body identical. There you go. All right. Well, there we are. Deborah says, question, I just got testosterone cream from the compounding pharmacy. Where is it best to put it on? Inner arms, inner thighs? I have heard that hair growth in this area happens. Well, testosterone is associated with the darkening and the thickening of the hair follicles. So if I did it, I would put it on the inner side where your blood vessels are here, on the insides of your wrists. That's where I apply a lot of my hormones, except I put my estradiol on my face because I like the elastin collagen to uh, work to hold my face up and keep the wrinkles without a facelift and stuff like that. But that's where I would put it all the time. And really, hair doesn't grow here. And it should be a low dose. If you were prescribed testosterone, typically a milligram a day or two for a woman is very, very tolerable. And that helps us with our muscle mass, and it's very valuable to uh, the woman and her bodily health. So hopefully that's where I would say it. The idea that if you start rubbing it elsewhere, even on your inner thighs, hair does grow there. It will promote hair growth. And so you might rotate it. They'll say one thigh, then the other thigh the next day, and then one arm, the other arm. All these are fine. The vast majority of women do not get this hair growth, so don't go looking for it. As women get older, um, and I test my hormone levels, my estradiol, my progesterone. And now that I'm 70, I do cycle monthly. Even though I have these hormones, I am still having some thickening of the hair on my chin, and I'll have to pluck, a hair just to, and it's darker, and it's unfortunate, but that's the way it goes. And I don't mind doing that. I would far rather have the energy and the health and be able to do my workouts and weight training and lift up my grandson, my little toddler grandsons, and enjoy that than worry about having to check or pull a hair on my chin every so often. Um, let's see. Deborah also asks, it is amazing how little research has been done on postmenopausal care for women. What is your thought on the bill being pushed in the Senate to garner more funding? I'm I'm for research, absolutely on this, but I am very suspicious of federal funding for anything now. It's as if it is a candy that you offer out to children before you kidnap them and abuse them. I see federal funding as a common corruption pool for all institutions. And I think people who want answers should make their case, find their own funding, because people who pull it out of their own pockets, um, even wealthier people who can offer more for it, they're going to watch their money. But when you have some big government that can tax the population and just get in all this money and print it out of nothing, because the Federal Reserve is not federal and there's no reserves, they just print money out of nothing. They can use this in very concerning ways, making people dependent on a productionless institution called government rather than true hard work and activities, and get people addicted to it. And then they lie to keep working in their position in government, to support this endless dope of money coming to support their bureaucratic job and office, and just ignore the truth that it's corruption filled. I was on active duty. I've worked in government healthcare as a physician. It's not good. All right, let's see. How far did we get here? All right, MD says, what are there vast differences between the synthetic hormones versus plant-based? Well, there really isn't plant-based. There's human bioidentical estradiol, estriol, estrone, and human bioidentical testosterone. Excuse me. And these uh, these can be made, exact copies of the human uh, female hormone. Uh, we can use precursors. Uh, I had one patient, I don't know, 20, 30 years ago, asked me, do they harvest dead women's ovaries? And I said, no, most of the women who have died are so old their ovaries don't work anymore. Now, the original synthetics were equine estrogen, horse estrogen derivatives, and these are not natural at all. That was in the Premarin type original hormones. And they're meant for a 2,000-pound horse, a female horse. So those estradiols, I think, have long since been poo-pooed. You can still get Premarin type products, but I haven't seen that in years and years now. The estradiol is now educated into the population and the medical prescribing force, so that I think almost all the patches and the estradiol tablet, these are all pure, perfect human female bioidentical estradiol. So that is safe. It needs to be monitored. You should check it twice a year, probably. It should be balanced with progesterone. I'm against prescribing estradiol without giving progesterone as well, or at least cyclically, half the month. So that's what I would say about that. So it's really the potency, MD, vast differences between the synthetic. And when we say synthetic, let's call those the equine horse-derived estrogen products of the 40s, 50s, 60s in Premarin products, okay? and the plant-based references the concept that these are biochemically transformed into human pure identical estradiol. So yeah, there's differences, and yes, it's important. Deborah says, what are your thoughts on hyaluronic acid or methylsulfonylmethane, MSM? I need something for joint pain. I am hoping testosterone will help. I do take progesterone and estrogen. Well, Deborah, um, joint pain as we age is very much associated with our lifestyle, our weight, our activity level, our muscle strength, how much water we drink. Um, our enzymes decline with age. And that's another thing, by the way. I don't give hormones to women who won't take enzymes. So if young girls have lots of enzymes in them and they heal up quick and their joints are moving nice, I insist on trying to recreate youthfulness in hormone replacement by demanding that they drink their water every day, that they take their systemic enzymes on an empty stomach every day, and they balance with progesterone. They let me check their levels once or twice a year and go from there. So regarding the joints, estradiol and progesterone are natural hormones, help us with growth repair and maintenance, even of things like our tendons and cartilage. So yes, women do get less hip pain and longer. Like I'm at 70 and have absolutely zero joint pain. I have no hip pain. I have no shoulder joint, anything pain. And I think it's because I have been using my hormones since age 37, and I'm 70 now, so that's 33 years. And yes, they will help your joints, but not outside of drinking plenty of water and not outside of being on a low carb diet and not outside of trying to stay away from inflaming foods that are genetically modified, that inflame the gut, that create inflammation, that will inflame the joints and the blood vessels and give you migraines and all kinds of things. So nothing is ever a single item. Everything is a style of living. So I like MSM. I like hyaluronic acid, but I rarely ever need it in women who will do the basics of the water, the low carb, not eat late at night, look at eating a simple menu, rotating their diet so food allergies don't develop, taking their natural hormones, taking their enzymes, and so forth. So yeah, and sometimes joint injections, if you've already injured your joint, they'll use things like hyaluronic acid involved in the collagen elastin linkage between collagen and elastin. And you need vitamin C for that. Microcirculation, EDTA improves all body tissue everywhere. That's why I always recommend chelation with vitamin C on a routine, ongoing basis. The next question is Dolores. Hi, Dr. Rita. My son is on Rosuvastatin 20 milligrams since last September of 23. His cholesterol was 198 and triglycerides 302. He has to, she goes on to say, he needs to go back to be retested since taking this medication. What are your thoughts about his cholesterol and triglyceride levels? He is 52 years old. He has been bitten by the carbohydrate addiction monster that we've all been bitten by. High fructose corn syrup, hidden in ketchup, hidden in soft drinks, lattes, all these frappuccino drinks and flavors, all the high fructose corn syrup in gummies and all these treats, high fructose corn syrup in so many commodities, too much fruits, too many sugars, starches, carbs, pasta, nuts, seeds, bread, pasta, rice, beans. All this sugar is not being burnt up. So we're eating to gratify, and they market to us. They do all of this activity to promote through commercial, manage your reaction, your thought, your environmental responses to seeing, smelling, hearing, pictures of people taking pictures of their meals, sending them out to say, look what I'm eating, and all this. We are marketed to like little lab rats to eat, 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 consume, consume, buy, buy, buy. And these have addicting features to them. High fructose corn syrup, fructose, is so addicting. Then we just keep on eating and keep on eating and keep on eating. Our insulin goes up, the blood vessels thicken. We don't burn down all the sugar. The sugar hits the lining of our blood vessels, and that hit to the endothelium creates micro damages. That sets up a injury site, which will start attracting inflammatory initial repair reactions, which, if hit by these sugars, which happens every day, it's never ending. Then we start getting calcifications of these sites, and we get plaque, and then we get vascular disease. The intima lining of the blood vessels are hypertrophied through the action of insulin, and they'll never tell you to lower your sugar, starch, carb, uh, uh, sugary drinks, and so forth. Or they'll say, you're such a typical human being. You are nothing more than they're taught evolution, that you crawled out of a swamp. You'll never change. Just eat it, take the drugs, and let us make money off of your coronary bypass. And the cholesterol suppression. Basically, since our cell membranes here are made up of a lot of cholesterol to help them with their uh, plasticity and cell membrane function, if you take away the cholesterol and lower it, then the cell membrane becomes stiffer, your brain function, just all kinds of things can go wrong. Memory, aging, decline. When I am just known for being a doctor that says, take responsibility, I believe in my patients. I see them as created by God, not some swamp creature that crawled out of a pond. I'm against evolution. It's already been proven wrong. And so I try and tell each of my patients how unique they are and how valuable they are. I just had a woman today who I was seeing, and she was talking about she's in her 70s and she has her grandchildren. And I think she was up in my hometown. It was a telehealth visit. And I was telling her how important maintaining your health is, because all her history of experience, all her knowledge, all her service memories, this is so valuable to her children, to her in laws, her daughter in law, to her grandchildren. They need to see and have this link to the past through grandma and grandpa. And I said, there's no one that can fill that role but you. That's how important you are, and in so many other ways. And she was told me how that really inspired her to take care of herself. That it does mean something. So I really dislike these 7-minute visits with doctors and drugging you. So I don't like Rosuvastatin. Besides the 180, what was that, 198 was his cholesterol. When I was a young doctor in the 70s, starting to practice medicine, my military men were all having cholesterols of 430, 360. And those men back in the 70s were much healthier, stronger, less medical issues. And so the triglycerides that I think she said his triglycerides were elevated. What were they? 302. Look at his triglyceride should probably be around 50, 60. And so this is all messed up. These doctors aren't going to sit here help the patient realize their value, um, how unique they are, and to disengage from the marketing propaganda to get you to be a consumer, to harm yourself, to gratify this whole, because nobody loves you, nobody cares about you. Yes, you do matter. All my patients matter to me. And I just really point out this to them, and I ask them to change their lifestyles for that reason. Everyone is valuable. For God so loved the world that he gave his only begotten Son, that whosoever believeth on him should not perish but have everlasting life. I live by this. I am a follower of Jesus Christ. Therefore, I must serve each of my patients with that love for them and their hope. So, yeah, I don't like Rosuvastatin at all. Try and get him to see a good functional doctor, someone who loves being a doctor, someone who loves their patients and will stay informed. Uh, Dolores went on to say he needs to go back to be retested. Yeah. So exercise, don't eat late, become more like a simple eater, eating a protein and a vegetable for dinner and lunch the next day, fasting more, skipping breakfasts. And that should turn around. If he's only 52, my goodness, that's his most productive time in life, is really from 50 to 80. So let's keep on encouraging him. Barbara says, so have any experience or recommendations for essential oils? Yeah, these essential oils, lavender, these Bach remedies, flower essence oils. I in the world that I work in the time that I'm seeing patients, there are many wonderful things out there. So there are people who do work with these oils, and they have their benefit, but it's such a niche kind of thing, and the impact that I've seen has not been as moving as just exercising, as drinking enough water, as um, not eating late at night, as valuable as lowering your carbs. So I'm not against essential oils and Bach remedies and things like this, but I don't have the time to practice it in my office. But I do appreciate it, and it does have scientific value. And God didn't create these oils and flower essences uh, for no reason. And so I'm not going to put it down. I just don't find the impact that great. Now, maybe if that's all I did, I would find it to be impactful in that niche of the world that I'm working in. But certainly, it's not going to overcome the high carbohydrate, inactivity, lack of water, dehydrated patient. Dolores said, "What are your thoughts about his cholesterol and triglycerides level? He is 52 years old." Yeah, I already addressed that one. Christina, my husband said he has muscle fatigue. Some days it's worse than others. Any tips? Well, I'd begin by, I don't know how old he is, what comorbidities or medications he might be, because statins will often give muscle aches. And many times patients are given statin cholesterol lowering drugs so liberally, they start coming in for other joint pains, muscle pains, and it's all since they started a statin. So look at that, get water in them, half his weight in pounds as ounces of water every day. If he does this for 3 days, he'll start seeing the difference. And systemic enzymes to disinflame. Don't eat after 6 o'clock, and then try and keep the carbs low, or even have him do a 24 to 48-hour water fast. And minerals are very important. And the cell membrane of all the muscles, these membranes here, these cell membranes are made of cholesterol and fat phospholipid proteins, two sides to that cell membrane, and protein. So have them eat plenty of fish, turkey, chicken, beef, and eggs, systemic enzymes, and see if he doesn't improve right away, and check some of those things out. Maria said, will starting hormones at 55 mess with my perimenopausal bleeding periods or prolong my journey to menopause? Well, I've certainly prolonged mine because I menstruate about this time every month because I use my progesterone from day 1 through 15, and I always start my period right around the 14th, 15th, or 16th. And so I haven't gone through menopause, you might say. I've never let it happen, just like a man has his testosterone up to his dying day. So I don't want to go to menopause. I want to live in pre, you know, natural hormones and monitor them and live a healthy lifestyle. Now, when I give hormones to my patients in their 40s and 50s, I'm always looking at uh, trying to educate them to say by the time you're in your 40s, you're probably only ovulating maybe 3 times a year. That's why you're less fertile as you get older. And so to think that you run your menstrual cycle by ovulational monthly cycles is a fallacy. And so I'm trying to find out the right time to take lead in the dance, lead them in the dance by giving them the natural hormones on a cyclical basis and kind of get them on a cycle. So I'm in a cycle where I'm on my estradiol every day, just like the woman always has estradiol every day made. But a woman only makes progesterone about 2 weeks out of a month. She has under the influence of progesterone. So I give myself progesterone day 1 through 15 every month. So I always have a light cycle right around the middle of the month. So I have not relied on my own follicle stimulating luteinizing hormone, and that's old. It's not working anymore. And I just use the natural hormones. So when someone is saying perimenopausal bleeding periods, I'm always going to give them the option to keep their cycle going. Yeah. So Maria, that's what I would do if you see a functional doctor. Jennifer, a friend's young daughter has pancreatitis. How to treat it holistically? Well, I would work with your doctor. Again, none of this advice is meant to be individual personal advice. This is just how I'm thinking about all these challenges and medical concerns. But you have to have your own functional doctor. You have to see your medical doctor. That's a serious all these things are serious. And so pancreatitis is no small thing. The pancreas has become inflamed, and then the enzymes and the insulin production in the pancreas can get all messed up with breakup of the cells that are in the pancreas, and you can become a diabetic and have trouble with insulin production, and you can have trouble with pain and vomiting, diarrhea, all these kind of things. So holistically, you need to work with a functional doctor alongside of your medical doctor to try and find out your blood type, uh, your digestive stressors. Are you having food allergies? Are you having a high carb diet? Are you overtaxing the pancreas with a high carb diet and the beta cells, islets of Langerhans producing insulin, and learning how to provide the phospholipid lining that will help heal the cells there, which are from eating meat, fish, turkey, chicken, beef, eggs, and so forth. And maybe giving digestive enzymes to give the pancreas a break from making so many of the enzyme productions. So this is a complex thing, and you need to work in tandem with your gastroenterologist or internist that's helping the person with a pancreatitis. Karen says, do you have any experience or recommendation regarding use of a photon infrared light? Well, I would say yes. I'm all for infrared because it helps with electromagnetic energy, and that energy can be absorbed into the human body and helps with function because we are all electrochemical beings. I mean, just the mere lining of this uh, cell membrane here, the difference in electricity from the inside of the membrane to the outside of a membrane has a voltage. And if you touch it, move it, bring a electrolyte, a positive ion, a negative ion to the membrane, these voltages and potentials are going to vary. And this is talking to the cell and the function of the cell. So when you bring in infrared light, this is bringing energy supportive to the cell membrane and very helpful. So yeah, I'm very, very supportive of infrared therapy and these light therapies. Um, Maria D says, wow, interesting. It never occurred to me that you could keep periods going. Thank you. Also, what systemic enzymes do you recommend? I use, there's various forms, but, and there's many out there. Are they good? Do they have in them what the label is saying? See, as a doctor, my management of my patients is critical to me. So I want to know what's in my supplements. Therefore, I deal with just a very few suppliers. We fly out to them. My prior history and training in chemistry, I'm able to look at assays and quarantine lot numbers, sample size. Um, assays of contents, and so you start developing a relationship with these suppliers and these makers, and they start realizing you're the real deal, you really care, your patients depend on the quality of it, and it's just a win-win situation when doctors start going to these places and getting really involved. So the ones I use are Vitalzyme. This is one produced by a Japanese pharmaceutical. It's more expensive, but it's an extremely high quality systemic enzyme. 3 a day is the standard recommended dose on an empty stomach. Then I helped Orthomolecular with developing Vascuzyme to bring it up to the quality near to the Vitalzyme that's produced as a pharmaceutical in Japan. We can get it here without prescription. Our laws are different. But in Japan, Vitalzyme is a prescription item, but here it's not. So fortunately, we can use that. Vascuzyme, our systemic enzymes, is the name of our private label of that, taken on an empty stomach. Let's see. Red Lisab says, I had a hysterectomy 41 years ago and for sure menopause. Okay, yes, especially if they took the ovaries at the same time they took your uterus. I'm on the estradiol patch, but it's not helping. I'm 61 and have gallstones and horrid digestion. My pancreas isn't working well either. My primary care doctor wants me to take progesterone too. I would agree, but it makes me depressed. Maybe the oil would be better than prometrium, too high of a dose. I also just started taking magnesium. um, they didn't take the ovaries. Well, by now the ovaries are non-functional. So yeah, there are many ways to work with the patient on progesterone dosing, and the cream, the troches in the mouth sublingually, various compounding doses of the progesterone level. And so we would want to work with you, Red Sub, as knowing where you're at in age, your blood type, inflammation. Are you on enzymes? What is your diet like? How late are you eating? What is your exercise level? What is your healing, rehabilitation, sleep time like? All these things would come into play. Uh, and then we would want to look at your digestion, especially with your blood type, maybe a stool analysis, and track you that way along with your primary care. But I'm very pleased to hear your primary care is starting to use natural hormones. And this is most encouraging. I mean, I will die someday and we have to train the younger people. and leave a heritage to them. So um, Karen D says, thank you so much. Well, we're here to serve, all right, so how much time do we have left? We got through all the live questions so far, and I haven't even gotten to my email. Ruth says, I'm scheduled for an MRI and 2 MRAs with contrast. Should I have chelation as soon as possible afterwards? Well, I would certainly encourage, because these contrasts are usually a gadolinium heavy metal, which is toxic. It's a dye, so that they can outline the features of the tissues much better and with more accuracy. So if you had the MRI or the contrast imaging study, I would try and get the EDTA chelation afterwards, the same day or the next day. Now, it'll be helpful 10 days, 2 weeks, 3 months even later, but the quicker you do it, I think the easier it is to capture it before it tries to embed itself deep into bone or fat. So yes, I would do that. Helen says, a mammogram report from May 7th found a focal asymmetry in the central region of my left breast. Was told to schedule an appointment for another mammogram and ultrasound of my left breast. Do you think it's safe to get a second mammogram with the radiation? Yes, I would, because there's an area of concern now. I had a CT scan that same day, full chest to pelvis, or is there an alternative? No, Helen, you need to follow through on the advice of the doctors who did the study and saw the area there, and let them do a more focal, targeted look. The ultrasound is very benign. The second mammogram will be more focal, and I would do it and follow their advice on that. Heather says, I was a patient of Dr. Warwick. I need help dealing with my gut issues. I had gastritis, so was taking Pepcid. I no longer take that and have been taking glutagenics, SBI Protect, and probiotic 225. Also doing the diet for inflammation foods. I have SIBO. What antimicrobials can I take, and when do I take what? Also FODMAP diet. Well, if you did a complete digestive stool analysis, we could get a layout of the various kinds of natural items, maybe like uva ursi or silver or grapeseed extract. But I would do a complete digestive stool analysis and see another functional doctor there, Heather, and go from that point. Christina asks, what is a better bread option if you had to pick? White wheat sourdough, or are they all the same? Well, if the grains are coming from the American genetically modified glyphosated sources, I think they're all horrible. I think we get too much of this, especially in light of we've had so much sugar, high fructose syrup, and we have carbohydrate problems and addictive behaviors to the sugars that was done purposely to us. We have to be very cautious. But if I had to pick one, I'd probably go with the sourdough, and only with grain made from Europe. That would be my answer. And try and only use it limitedly. Patricia says, I experience vertigo every so often, and I'm trying to figure out what triggers this. I drink my water and follow your recommendations: diet, exercise, sleep well. I usually can stop the vertigo by doing the Epley maneuvers, but this time it's lingering and is frightening and debilitating. Would exposure to too much Wi-Fi, etc., be a cause? Thank you, Dr. E. Well, it certainly is another form of disruptive cell membrane challenging to create more irritation. Um, and I assume you're on enzymes. I don't know if you're doing chelation therapy, but that is a very good thing to improve the microcirculation and help repair things more quickly. Um, I don't know what your highly sensitive C-reactive protein is, your SED rate, your insulin level. All these things have to be looked at to try and get a better experience, because it's inflammation in the loops of Helene that are in our ears and deep in our brain, that are fluid levels with otoliths and little hairs in these tubes that give the fluid flow to be, binary side to side. So you have to look into that. Um, Try and get your doctor to evaluate that. Chris says, we've had a bout of flu here. The kids had it first. It involved throwing up and diarrhea and fever. They have recovered. Took about 5 days, but now I have the runs. I've been using the LifeWave patches and taking charcoal. Is there anything else you would recommend? Well, I would go on a clear liquid diet for like a chicken broth, beef broth for 2 days and just let your gut heal. And that would be my very first step as well. So I would go from there. And of course, if it's not improved, you have to be seen. Christine says, can a specialized diet impede the progression of cancer? Well, absolutely, because cancer is so much dependent on eating a high carb diet, because a dysfunctional cancer cell usually means the mitochondrial batteries of the growing tumor cells cannot process fatty acids, and so they depend on sugar continuously. There's only 2 ATP produced for every mitochondria that is in an aerobic, low oxygen, acidic environment, and that's what fast growing tumors live in. Versus a healthy cell can work with oxygen and burn the fat and gets 34 ATP energy cycles. So a extremely low carb diet, fasting, will help impede it. Hayden says, I have polycystic ovarian syndrome and suspect my 17-year-old daughter may have it as well. Is there a genetic component? Is there a way to get tested without blood work? Clinically has a phobia of needles. What can I be giving her just in case she has it? That would also be okay for her if she doesn't have it, to help support her until we're able to navigate needles. Well, progesterone cyclically, day 15 through 25 of her cycle, a low carb diet, and systemic enzymes. And I addressed that earlier. So if you go back in today's audio video, you can look into that. Nikki says, what, if anything, have you found to help control foot and nail fungus? Well, you got to know your fasting blood sugar, and what they call normal is not normal to us. We need that blood sugar never to be fasted higher than 85. Your insulin never higher than 4 fasting. Your triglycerides never to be higher than your HDL, somewhere in the range of 50 to 70 maybe, and your hemoglobin A1C to be 5.2. Then I would apply, right to the toenail or the nail involved, Argentine silver, which is a silver-based liquid that will sink into the nail and under the cell to fight fungus. And then lastly, I guess we're over, but maybe I can take a quick peek on page 2 here. I have a dear friend who would love to be a patient at TLC, and she's waiting. She's on the waiting list. Is there another way she might get an appointment? She's fed up with traditional medicine. They keep prescribing meds that get her sick, dizzy, and nauseous. Pray for us. We are trying very hard to find good doctors and to work with helping train them and educate them, and pray for us and for our health and our stamina, because we're trying to fill this hole, and we'll do the best we can. Donna says, what is the brand of berberine you use and recommend? It's TLC metabolic formula, or the other one by Orthomolecular is called dioxinol. And does this help with sugar cravings? Well, not really. It helps burn the sugar down. So if you don't keep on taking in the offending, addicting agent, then once you get on the other side of the higher sugars, the ghrelin hormone that gives you cravings gets lower and lower. And within about 3 days, it should go away. Bettina says, hi, Dr. Ellithorpe. Thank you for all the work you do. What treatment do you recommend for perioral dermatitis around the mouth? I'm 58 years old. Usually that's a B vitamin deficiency. I would take methyl TLC methyl B complex, TLC methyl B complex, be low carb, and then I would use Argentine silver to stop all the bacterial and growing into the corners there. Sherry says, I'm 64 years old and I have been on MP thyroid for at least 10 to 15 years, 3 tablets a day. I was wondering if I would ever be able to get off of it, or do I need to be on it the rest of my life? I just hate being on pharmaceutical products. Well, I'm going to be on my natural hormones all my life, estradiol and progesterone and DHEA. And I am on thyroid because this gland of mine doesn't work as well. So natural hormones, glandular hormones, are only being given because the function of the organ is not working as well. So in that sense, you're not on pharmaceuticals, you're on natural hormone replacement therapy. And Melanie says, I have been diagnosed with severe osteoporosis. How would you treat this? Well, all the things I've been saying: exercise, stomping, vitamin D, higher levels, 80 to 120 on your lab reports, with K2, taking a TLC multimineral, natural hormone replacement, progesterone, estradiol, a low carb diet. And these are the ways we keep our women and ourselves healthy here. So we've gone over at 6 minutes after. I need to go exercise. My husband's waiting on me. Interesting. Cheryl says, I got rid of my vertigo by going on low oxalates. Yeah, if you're seeing a good functional doctor, they're going to be thinking about phytates, tannins, lectins, oxalates. Plants have materials in them that can be harming to us. And then Maria D says, thank you so much. So to all of you, dear souls out there, we say God bless, and we'll see you next week in Tuesday at 6 p.m. Please like and subscribe and refer this to a friend or family. And God bless.